There's some misconceptions a little bit about what people could post and what they can't post, or what not even what they can't, but what they should or shouldn't. When it comes to like showing your personality and your personal life on social media, what are some of the ways that you navigate and balance that?
I don't know how much you share about yourself, but like you've worked with some of the biggest health people out there, right? Like you've supported me in my community previously, and then also Dr. Judith Joseph, who's a psychiatrist, and we also are active clinicians, which sets us apart, right? Because I think one of the things is some people are creating content on topics that they no longer work in. I am still a licensed clinician. I'm licensed in like 40, 42 states at this point. I see clients on Wednesdays. I do speaking on probably like weekends. I typically teach or do research on Tuesdays and Thursdays. So I can understand the whole concern about like what how to present yourself and things that you think you may not be able to share. I am not a clinician who believes in this whole aspect of being a blank slate because it's not possible. I have a psychologist, and if I found out that my psychologist voted for Trump or someone who didn't believe that certain individuals are humans, I would feel betrayed and I wouldn't want to give them money in the first place. So I always share my personality. I also do a really good job of giving 100 of 10%, right? Like you will have 100 of the 10% that I share when it comes to mental health information, when it comes to resources. You will not see my children or my husband. Because why? My husband's an accountant, so he's not helping you with mental health. And my children, it's unnecessary. So I kind of frame it that way. You decide what your non-negotiables are, what you're going to share and what you're not going to share. People always want more, but so what? Like it's your platform. It's also important about what you're trying to do with your content, what you want your focus to be, because just because you are a health professional, you have to decide what you want to get from social media. I'm a psychologist, I'm a professor, I'm also a professional speaker. I use it as my business card for certain topics, but I do not use my social media for clients, for therapy clients. Speaking clients, yes. Consultation, yes. At this point, I haven't had an opening in a minute, but my clientele when it comes to therapy are word of mouth from trusted sources. Because also people will think that they're getting Dr. Martin when it comes to psychoeducation online, but that's not who I am as a clinician. So it's also what is your goal from the social media? I think that's also something that you have to think about. Are you trying to get more clients? And if you're trying to get more clients, what kind of clients, right? I'm a
Mhm.
psychologist. There are plenty of psychologists who they conduct therapy and they also do coaching. Those are two entirely different things. So maybe they're trying to get coaching clients or therapy clients. There are therapists who one of their expertise is also helping clinicians build a clinical practice. So their goal is not to get clients in terms of therapy clients. Their goal is to get clients to help them build their own therapy practice. Their clients are other clinicians. It can be the fact that you are using social media as a realm of your healthcare, but you really just want to build your speaking arm. So you're really using this as your platform to talk about your expertise. You want to be on a certain stage. And the way you're going to do that is also building the following so people will know that you're talking about this particular topic. So that's the biggest thing about like what do you want? Just because you're in healthcare, there shouldn't be the assumption that your goal is to get more like therapy or medical clients. It could be you're trying to launch another arm. But I don't the goal is not to get therapy clients. Now I do know that some of my clients follow me, but some of my clients I've had for a significant amount of time, I do not talk about. I mean, we all know HIPAA, right? Like, I'm not about to lose my license for nobody. So, like, not sharing specific. I don't record like sessions that I'm doing. I don't believe in that anyway. I don't use AI for that kind of stuff either. If I'm talking about something general when it comes to a client, I might say something like, "Oh, a client had a question and this was a really helpful answer that resonated with them." But no identifying information. You would never be able to tell who my client is, he, she, or they. I actually typically use they pronouns when I'm using it anyway, because you couldn't even know it from that perspective. But I encourage everyone who's in the health field who's deciding to go into social media to expand the aspect of what you want to get, what your audience is when it comes down to it. It doesn't have to mean that you want more individuals from your practice. Maybe you do a really good job of building your practice and you can help someone build their own. So that's what your social media is. And if you're also in academia and you have concerns about individuals looking at your social media and having an issue with what you share, I typically tell individuals who have asked me about this to go over the social media with the person who has the concern. Because sometimes people will hear the word social media and it's like they think you have an OnlyFans or something insane like that. So if somebody had an issue with a post or like me having social media in general, I would say, okay, so I would love to address that because that is something that also increases my reach. It's once again is translational science and I'm able to reach my demographic in a way that I can't while being in this office. So I would love to go over the post that you had a concern with and tell me what was the issue. And most of the time, there is no issue from what you're posting. All of my stuff is stuff that you could find in a research article. I typically cite it in the actual post. So sharing that. Most people will also have in their bio that these views are my own. And I also follow a lot of other academics, and on their close friends, they'll share stuff like information for their friend or their person. And then on the general stuff, they're sharing their research and their science and stuff like that. I used to have two accounts, my personal account and my public account, but nothing that I post on my public account is anything that anyone would have a concern with. And if they do, they probably wouldn't have hired me. I'm the same person in every single room.
To watch the full combo, where Dr. Raquel breaks down how she lands speaking gigs, brand deals, and big opportunities, join Healthfluencer Hub, link below.